Chronic subdural hematoma in patients who are on antiplatelet medications or anticoagulants poses a significant challenge in management. Welcome to another episode of Stroke Rounds. This is an interesting case of a 45-year-old gentleman with coronary artery disease. During his angiography, he developed a severe headache, which continued despite taking analgesics. A CT scan later revealed a chronic subdural hematoma in the right temporoparietal region. He was in the immediate post-stenting phase on antiplatelet medications, which could not be stopped. The option of middle meningeal artery embolization was explained. The patient consented and was taken up for the procedure. As part of the protocol, we first performed a right internal carotid angiogram. This helps us assess the vascular anatomy, especially the ophthalmic artery and its branches. Next, we selectively cannulated the external carotid artery. A selective angiogram showed the superficial temporal artery and the middle meningeal artery with its branches. Using a microcatheter, we cannulated the anterior division of the right middle meningeal artery. A selective angiogram through this division showed some concerning findings. There was an anastomosis supplying the right eye from the anterior division of the middle meningeal artery. This is a dangerous situation. If we use particle embolization, there's a risk that particles could travel through the anastomosis and potentially cause visual loss. To avoid this complication, we decided to embolize coils alone. We targeted the trunk of both the anterior and posterior divisions of the middle meningeal artery. First, a coil was deployed. This was confirmed on both AP and lateral views. However, there was still some flow. So we placed one more coil. Following this, there was complete occlusion of both divisions. The patient had an excellent outcome. His headache, which was his main symptom, almost completely subsided on the table. At 3 weeks follow-up, a CT scan showed complete resolution of the subdural hematoma. The key takeaway here is this: coil embolization of the middle meningeal artery alone, without using particles, can be safe and effective. This approach is supported by emerging literature, and we will be discussing those articles in future episodes. Thank you for listening. Please share your comments, thoughts, and opinions. See you next time in another episode of Stroke Rounds.